came around. So we'll be starting with the preliminary rounds. Before then, I would like to invite the member of the high table. So please, just like we did it yesterday, we would love us to really appreciate them as we call them. So the first person I will be calling is Dr. Adebayo. Please appreciate him. Let's appreciate him. Let's appreciate him. Thank you so much, sir, for your presence with us. We really appreciate it. Let's keep clapping till he gets to his seat, please. Thank you, sir. We appreciate your presence with us since yesterday. The next person I'll be calling is the LOC chairman, in the person of Adirogba Saeed. Let's appreciate him. And also I'll be inviting the head of academics in the person of Adegosin Precious. So thank you. So now I'll be inviting the participants from FOMSA. So when I call you people, you're going to come and occupy the front seats here. So let's jam our hands together as they are coming to the front. So people from the FOMSA, can you come and occupy the seats here? Thank you. So the preliminary round will be starting. Please let's pay attention, just like we did it yesterday. No noise, no noise. We don't want any distraction for them. Thank you all.
Because we're not addressing the preliminary rounds. So the quiz competition is divided into the preliminary rounds and the final rounds. So for the preliminary rounds, the quiz structure will consist of a blitz section and a traditional quiz section. So for the blitz section, you'll be answering a total of 20 questions in 2 minutes, 120 seconds. And each each correctly answered question in the blitz section carries 2 points. 2 points. So giving you a total maximum of technical score of 40 points in the blitz. However, for the traditional quiz is further divided into basic medical sciences, basic clinical sciences, clinical sciences A, clinical sciences B, general knowledge, and general sciences. So each correct answer in the blitz round, in the traditional quiz, attracts 5 points. Incorrect answers attract 0 points. Correctly answered bonus questions, which does not apply in your case. So the traditional quiz will also feature German-style questions, which are structural questions. And for the German-style questions, you only have 2 attempts to give the correct answer. Then there will also be multiple choice questions for which you'll be given 1 attempt. So each question must be answered. For the traditional quiz, each question must be answered within 15 seconds. 15 seconds. That's the traditional quiz. So for the general quiz, participants are expected to maintain professionalism throughout the competition, remain seated during the conversation, avoid any form of malpractice or external assistance, respect the producer, judges, moderators, and officials, adhere strictly to time instructions, avoid interruptions while questions are being raised, and ensure proper coordination among team members. So we'll be starting with the police round for your
Sorry, Chief. Sorry, I have a question. Are we going to pick reports?
Yeah, you're going to speak between the three advanced reports. Port 7. Okay, so IFUMSA will be answering questions from port 7. Technical team, preliminary rounds, port 7. Okay. Whenever you are ready, or do you have any questions? No. Okay.
So, good morning once again. IFUMSA, you are welcome. People from the ancient city of Ife. I'm related to Ife both by birth and by house job. So you're welcome. Are you ready? Yes. Are you guys ready? Yes. All right. Can we start? All right. A patient with recurrent bacterial infection has a percentage of oxidative burst on testing. What's most likely diagnosis? Chronic rheumatoid. Which country has the largest influence in the world?
Brazil.
Which cranial nerve is the most likely injured in patients who cannot adduct?
Abdussalam.
Alright. What is the capital of Kazakhstan? Kazakhstan.
Wrong. Blue Sultan. Wrong.
Next. Which cardiac condition is characterized by paradoxically split second?
BSD.
Next. Which calculation factor is deficient in chemotherapy? 9.
Correct.
Which is the largest
Great Barrier Reef, Australia.
Alright. A patient with muscle weakness, hyperexia, autonomic dysfunction. Alright. Which bacterium is the Which scientist won 2 Nobel Prizes?
Marie Curie.
Which electrical abnormality is most commonly associated with
Hyponatremia. Next.
Which artery supplies the synovial node in most?
Right coronary artery.
Which is the largest peninsula in the world?
Arabian Peninsula.
Which is necessary for type 1
IG.
Alright, a patient with recurrent kidney stones, medullary carcinosis, and hyperchloremic metabolic acidosis.
Multicystic kidney disease. Next.
Which country has the world highest navigable lake?
Russia.
Next.
Which chromosome is affected in
Chromosome 5.
Which parasite is the leading cause of cystic lesions in the liver?
Echinococcus.
Which famous canal connects the Mediterranean Sea to the Red Sea?
Guyon Canal.
Which endocrine tumor classically causes watery diarrhea, academia, and achlorhydria?
Venemoisin syndrome.
Carcinoid.
Wrong.
Is a Vicoma now?
Venemoisin. Number 1.
The canal.
Vicoma is correct.
Suez Canal. For the canal. Suez
Suez Canal.
I cannot say type 2. Which The question number
19. Which famous canal for the Mediterranean Sea?
Astana, Kazakhstan.
You said Astana for Kazakhstan.
The paradoxical ASD.
19, number 19.
That nephrocal
Suez Canal.
Correct. The nephrocalcinosis. Alpha type 1 or alpha type 2? Alpha type 1.
Time up. So a round of applause for Efumsa. Alright, so
Sorry.
while we're having the next session, the Quizmaster work inside. Dr. Latide. Alright, so Efumsa, I can have your sister. Sorry, please, can we know? So I think we are starting with basic medical sciences. Starting with this. I can't hear you.
Can we review so we can?
Made an answer. And there was no
Because we might have forgotten by the time we come back at the end.
question of.
So we like to know our scores.
It's a blitz round and there's no review for it.
Okay, but there was one answer I made, but there was no.
Which one?
The nephrocalcinosis is correct.
The remark? Alright. Are we cool now?
Yes, sir.
Alright. So basic medical sciences. So unfortunately some of the questions that were answered yesterday. So if you pick an answer, they pick you. If you pick a question, they pick people. We might tell you to pick another question. Is that good? Alright. So for now we have from questions 1 to 50. So alright, so just pick from 35 to 50. Most of the earlier ones have been picked already. Questions. Question what? 40. Alright, let me check. Alright, question 40. Please display question 40. Alright, at the neuromuscular junction is one answer. It has been picked. Alright, so please pick another question. 41. 41. Okay, 41 is free. A patient with severe glucose-6-phosphate dehydrogenase deficiency develops acute hemolysis after taking primaquine. Which metabolite decreases first within the affected erythrocyte? NADPH is correct. Another question, please. 42. 42. Please, display 42, please. A patient with mutation that prevents activation of pyruvate carboxylase, which metabolite would be expected to increase most rapidly after an overnight fast? One answer, one attempt. I can't hear you. Oxalazepate is wrong. Please answer. So your last question is wrong. 43. Question 43. Alright, please display 43. An experimental drug blocks transport of long-chain fatty acids into the mitochondrial matrix without affecting other metabolic pathways. Which metabolic process would continue normally? A. Beta oxidation of palmitates. B. Ketone body synthesis from palmitates. C. Oxidation of medium-chain fatty acids. D. Formation of acetyl-CoA from palmitates. One attempt, one answer. Oxidation of medium chain fatty acid is correct. So we move to basic clinical sciences. All right, so you have 4 questions to pick from this round.
From which number to which number?
So let's go from 35 to 50 again, please.
It's fine. 49.
49. Please display 49. One attempt. Which of the following shows ANCA positivity? A. Polyarteritis nodosa. B. Church-Shaw's syndrome. B. Buerger's disease. D. Janssen arteritis.
B. George Strauss.
Church-Shaw's is correct. The second question.
44.
Question number 44. It has been answered. Another question, please.
42.
Question 42 is straight. Please display. According to FAB classification, which AML is associated with eosinophilia? 2 attempts.
M5.
No.
M4.
All right. M4 is correct. All right. Your third question, please.
Question 46.
Question 46. 46 is not available.
37.
Sir?
37.
37. 37 is free. Batten-Coswick syndrome is due to mutation in which gene? 2 attempts.
P53.
Wrong.
Picard.
Wrong. Please display the answer. Your fourth question, please.
35.
Question 35. Let me check. It's picked already.
46.
46. You
41.
just lost that,
41.
41. All right, please display 41. What is the characteristic chemical finding in Guglielmo disease? 2 attempts. 15 seconds.
Miyagawa bodies.
Wrong.
Atypical lymphocyte.
Wrong. Display the answer. Okay. So now we move to we move to clinical A. Clinical science A, which is pediatrics and OBGYN. Okay. So again, you have from question, let's do 20 to 35. 20 to 35.
25.
Question what?
25.
Okay. It has been picked.
21.
21. 21 is gone.
20.
20. 20 is available. Please display 20. A cyanotic newborn fails the epirexial test. Echocardiography confirms transmission of the great arteries with an intact ventricular septum. What treatment should be started immediately?
Institution of PGA1 analog.
That's correct. All right. Your second question.
32.
Question 32. It's gone.
35.
35. Gone.
27.
27. 27 is available. Please get 27. A 6-month-old continues convulsing despite 2 appropriate doses of IV lorazepam. Blood glucose is normal and the airway is secured. What medication should be administered next?
Phenytoin.
Wrong. Second attempt.
Phenobarbital.
That's wrong. Please the answers. All right, your last question is wrong.
28.
Question 28. It has been picked.
22.
22. Okay, 22 is available. Please display 22. A premature infant develops abdominal distension, bloody stools, and pneumatosis intestinalis on abdominal radiograph. What is the initial management?
Rectal washout.
Wrong.
Enema saponis.
Wrong. Please display the answer. So that's your last question in this round. So we'll go to clinical science B, which will be medicine and surgery. So again, 20 to 35. 20 to 35.
25.
25. Let's check. All right, 25 is available. A 68-year-old man develops severe abdominal pain and lactic acidosis. CT demonstrates pneumatosis intestinalis with portal venous gas. What is the next best management?
Explorative laparotomy with gram patch.
All right, that's correct. All right. Next question.
30.
30 is available. A 66-year-old man develops persistent hair leak and failure of lung expansion 7 days after chest tube insertion for secondary spontaneous pneumothorax. What is the definitive management? Definitive management. 2 attempts.
Okay, tracheostomy.
Wrong, sir.
Pneumonectomy.
Also wrong. Please display the answer. Your last question, please.
Thirty-five. 35.
I think it's available. Please display. A 62-year-old man with cirrhosis develops fever and abdominal pain. Diagnosis by symptoms reveals a neutrophil count of 520 cells per millimeter cube and cultures are pending. What is the next best management?
Institution of empirical antibiotics.
Can you be specific?
The antibiotics. Okay, institution of broad spectrum antibiotics.
We'll give you half mark for that. Please display the answer. That's the second question. That's the third question, yes. All right. So we'll move ahead.
No, that's all. So now we are going to general knowledge. Okay. General science. We are going general science. Yes, general science. Let's do from 15 to 25. 2 questions. Fifteen to 25. 15. Okay. 15 is available. Please display. Choose the option opposite in meaning to the underlined word in italics. My father's advice to me was quite invaluable. Useless. Useless is correct. Before we come.
23.
All right.
23.
73. Okay. This is also simple. If x equals 924 raised to the power 2 minus 76 raised to the power 2, find the value of x in standard form. One attempt. C is the correct answer. All right. So the last round for IFOMSA, we're going to general knowledge. So again, 15 to 25. 15 to 25.
19.
19. Gone.
21.
21. All right. What animal eats rest? Eats rest and sleeps on its back. 2 attempts.
Sea otter.
Correct. All right. Your second question, and that will be the last question for IFOMSA.
24.
Question number 24 is gone.
25.
Question 25 is gone. It's a funny question. What's the world's biggest profession? It's gone. It's gone. I'm just asking you. What's the world's biggest profession? 25 is gone. Look at that question. Huh? 16. Question 16. It's gone.
17.
17. I think it's available. Please display 17. One attempt. Which of these countries does not operate a federal constitution? USA, Nigeria, Canada, France.
C. Canada.
C. Canada is the wrong answer. Please display the answer. All right, that's the end of the preliminary round for IFOMSA. We'll have your scores corrected and we await further instructions.
So that concludes the narrow rounds for the competition. So shortly we'll be going into the final rounds. So at the end of the preliminary, LAUMSA is leading with 116 points. Appreciate. LAUMSA with 100 points. Interestingly, IFUMSA has dethroned OMSA to third place. So they have a total of 83.5 points. OMSA has a total of 75.5 points. Then followed by BAMS with 58.5 points. Ashosa with 53 points. And then Kwasusa with 27.5 points. So shortly we'll be starting the final round. The top five will be put into the next round for the. So that is OMSA. Sitting to the next stage of the competition. Thank you so much.
So while we are waiting the instructions, so we are going to be taking one participant from each school. Just nominate one participant. You are not doing stuff, just one. Just one participant from each school.
Can we sit down?
Yeah, why not? You can sit down. You can sit down, please. Just sit down together now. You guys are friends now. All right. So we want to ask for feedback. If someone might not really the feel of what we've been doing since yesterday. So let's start with. We are from UMSA now. That was one of the apologies for coming late yesterday. Such a noble attitude. All right, so how has it been today? How's the experience been?
Good morning. Thank you so much for the question. Very decent experience overall. Particularly enjoyed the consistency in the rules across all teams. I think every team got the exact same amount of scrutiny and help. The parts I think are demerits, in my opinion. I think we would benefit from a blitz review, like when it's done, if we could review the questions we answered, the questions we got wrong.
You mean from the blitz, right?
Yes, I think we would benefit from the blitz review. And I later found out that it happened before we got here, but there were deviations from the round numbers with the memo we received. But I later found out that was voted on by the teammates before we go here. But overall, thank you once again.
All right, thank you very much for doing that. All right, that should be
Jimo Micro from the
LAUMSA, right?
LAUMSA, yes. Okay, I've enjoyed my time here. I would say this is the most fun I've had in a quiz in a long time. We've had very good and very commendable quiz masters, and I think the questions have also been standard, and overall I would say yes, it has been a very
Please, I can't find BAMS and what's it called? I can't find Rosumsa and is it Kwamsa? Kwasu. Where are the representatives? They've gone. Oh, okay, that's fine. All right. That's Lautech, right?
All right. I just feel everything is perfect, 100% perfect, from the questions to the organization to the logistics, and with the fact that this is just the first run, I feel everything will get better and better as time goes on.
That will be the man from BAMS.
From BAMS. The quiz has been very good. We've enjoyed our experience. We've had fun. Thanks for everything. And the feedback, during the quizzes, when we see the answer, the quiz master hesitates to say whether we are correct or wrong. And this now, and our time is going. So we don't know whether we should guess again or we should.
Why are you guessing?
Or we should continue or just another answer. So that's the feedback that you should take on board for the subsequent MedIQ quizzes.
All right.
Then also timing, like now let's start by 10, it's already close to 1. Yes, it feels very late.
Okay. Thank you very much for the honest review.
Thank you very much. I really don't have much to say.
Definitely.
The quiz has been fair, and I think the blitz session we can always review and check so that we can learn also as the quiz master is learning. Thank you very much.
All right. You can go back to the seats. Thank you very much. And the LOC chairman is asking, is any member of Osumsa around? No, they've all gone. All right, thank you very much. We've seen the scores. So I think we can ballot for the arrangement of the schools.
All right, so well done to all the participants. So we invited the schools that qualify for the final.
Tell him the podium, don't cover his face now. Tell him.
So the first school is sitting the seats that edge. The second school, they will occupy the second and third school will occupy the seats here. The fifth school will come here. Okay. So can we hear me now? Sorry. Can we hear me? Okay, so as I'm calling us, so we'll be filling the spaces accordingly. Is that clear? Is it clear? All right. You said?
I thought you wanted to balance while we are
I need to review. Alright, so each EMSA should send their MSA rather should send their representatives for balloting.
More music on trendybeats.com.
Gbàdúrà tí mo gbà ní òru ní kọ̀ọ̀kọ̀ bàbá jẹ́ ó wá sí mò ń ṣe. Gbogbo iṣẹ́ tí mo fàárọ̀ mi ṣe ọ̀sán mi àdálẹ́ májò dìbàjẹ́ aláṣẹ torí wọn lọ́lọ́run tó ní pẹpẹ. Ìwọ gángan bẹ̀bẹ̀ mo ní ká má tọrọ jẹ nínú mímu kì í pẹpẹ. Ọ̀tá tó bá mi lága wọ́n fẹ́ tẹ́. Bọ́lá wọn bá mi jà. Àdìjọ́ sáà ọ̀tọ̀ ọmọdún kúrú tí ó ṣe é dà. Èmi ọmọ náà àtàkì máa yẹ dà. Akẹ́kọ̀ọ́ ṣe jẹ́jẹ́, akẹ́kọ̀ọ́ ṣe jẹ́jẹ́ lórí pẹpẹ. Akẹ́kọ̀ọ́ ṣe jẹ́jẹ́, akẹ́kọ̀ọ́ ṣe jẹ́jẹ́ wá kọ́.
Alright, so thank you. We'll be inviting those colleagues to have the balloting. So the first one we'll be inviting is MSA. Please let us appreciate them as they are going to the We can do better, we can do better. It's not easy. MSA. Okay, the second is BAMS. Can we appreciate them? Can we appreciate them? Next, I have the MSA. Let's appreciate them, please. Let's appreciate them. It's not easy. Then we have the LAUMSA. And I have the LAUMSA as the last school here. Can we appreciate them?
Okay, good morning everybody. No, not morning, it's afternoon. Good afternoon. You are welcome to today's edition, or today's round of the MedIQ 1.0. I especially welcome students from IFE. Welcome on board. I'm so glad you are able to make it to participate in today's round. I also welcome the audience specifically. I appreciate your cooperation yesterday. I can only demand that you give more cooperation today. Like I said yesterday, try and manage your emotions. You'll be intrigued, you will be surprised, you will be disappointed, whatever the case may be. Please, I want you to do well to give these people all the cooperation they need to succeed today. All right. Please, I want all of the participants to look at the board, the screen, and confirm they can see it very well. Okay? Okay. All right. So we'll start immediately. But I need to respond to some of the observations raised by the participants. About the review of the blitz. Okay, we have decided that after every blitz session, we'll take time to go through the questions and so that you can know the answers like you requested. And if time permits, we also review the blitz for yesterday after the whole session of today, not in between. Okay? And then, yes, about the quiz master hesitating to confirm answer. Bams. You see, the quiz master is supposed to have minimal interference with the quiz. And at the same time, it's supposed to show, what will I call it now, guidance, or to show mercy whenever he deems fit. Now, when you for the German style question, you are supposed to give two answers. When you state the first one, I'm supposed to say correct if it is correct, or wrong if it is wrong, so that you can say the other one if you have. But sometimes, when you say the first answer, it's not wrong and it's not completely correct. So I usually keep silent, thinking that you would then amend the answer. Okay? Now, if you say the correct answer incompletely and I didn't make any reaction and you modified it will still count as the first answer you have supplied. Alright, but if I say it is wrong, that means you don't good that opportunity, you only have to say one more, and it might be wrong also. So that's why I give time, since you still have part of your 15 seconds counting, for you to think of modifying it. Okay? But going forward, in order not to bring bias, okay, once you say the first answer, whether it is correct or incompletely correct, you will hear the response. Okay, so that you only have to say just two options with no chance of modifying any of the responses. Is that clear? Accepted? I believe silence means yes. Okay, so, and think it's just good that we start immediately. So today we have sessions in basic medical science, basic clinical sciences A and B, just like yesterday. For FIMSA, clinical sciences is divided into two aspects. Aspect A and B, comprising of aspect A comprises of some specialties in the clinical sciences, while aspect B comprises of the other specialties. If I'm not wrong, I think A is O&G pediatrics, and then B is surgery special postings. Alright? Okay? Then we now go into general sciences and then general knowledge. For basic medical sciences, you have 3 questions per MSA in rounds. Okay, for basic clinicals, 4 questions. For clinical sciences A, 3 questions. Clinical sciences B, 3 questions. General science and general knowledge, 2 questions. Session. We have 7 ports, and you will pick a port by allotment. Okay? And each port consists of 20 questions, which you are expected to provide answers to within 2 minutes. Right? 2 minutes. At the end of 2 minutes, the stop. If you finish all the questions within 2 minutes and you have ones that you have not provided correct answers, you can request the questions again and then provide answers to them. Okay? So that's how it's going to go. Alright. 15 seconds for the questions of the fractional quiz. 120 seconds for the blitz session. The German style question, 2 options, 2 answers, or 2 attempts, let me say that, in 15 seconds, after which the bonus will pass to the MSA immediately next in line, and they have to provide the answer in 5 seconds and only 1 attempt. Okay? If you say 2 attempt, you pick the first one that you say. Alright? So, alright, go ahead.
I'll just specify that we made this decision because we have a member of our team who was complaining about headaches after the travel last night. So we told him to just sit down and put services. That's inconvenient.
Okay, that's the last guy, right? Okay. Are you aware of that?
This is my first time.
Oh. Alright, sit down.
I wanted to ask if we would get the chance to question, follow other things, want a reference of the number of questions per round.
The number of questions per round? Okay, when we get to that round, you'll be told the number of questions in that round. But what are you asking?
Sorry, I was asking if we could ask other quiz teams if they would rather have the number of questions per round tally with the invites or the way to go this.
Okay. Like the as consent to you in the invite. Alright, sit down.
Thank you, stay very much.
Okay. So, concerning your second issue, yes, we decided to reduce the number of questions per round because of time constraints, and I don't think it will. I don't think so. For example, in one of the sessions, we're supposed to answer some questions in the round. Okay? Basic to see whatever. As long as answering the same half of questions, it shouldn't make any difference. Okay? So that's it. Then about the substitution, the standing rule was that job will be not allowed. Okay? But for every rule, there is always an exception, the way they say. But that exception should be throughout the minute. And now, you have made the substitution. It's a good thing you notify us because we didn't even notice. Okay. But we have to find out if that is very comfortable with the other schools. Now, the reason they cited was that the person that they substituted is not feeling fine. Headaches, for that matter. Even the quizzing is enough to cause headaches. If you're not having headaches before you start the quiz, it can aggravate it, I mean. If it's a simple headache, now it can become something like migraine or cluster. I bet the ambulance is not close by. So, what do you think? Speak.
Thank you. I think that's actually really okay because it's an emergency. But I think in the interest of fairness, now that before we start, every school will have the opportunity of substitute one member if they want to.
Yes, that's why I asked. So, but that will be before we start, and there will not be opportunity to substitute until we finish the quiz. Okay, so Pams, do you want to make a substitution now?
Yes, we would like to do that.
All right. Ilumsa, you want to make Ifumsa rather, you want to make a substitution now? Laumsa, you want to make a substitution now? Alpha. Okay, so now it appears that there's only Pams that want to make a substitution. And you all agree that they can make a substitution now, right? Okay, if I may ask, is it possible you disclose the reason why you want to make a substitution? If not openly, can you come and tell me? All right, so it's not an emergency, but it's something that can be a plug in the wheel. So we should allow it. So make your substitution. But before you go ahead, and for OMSA too, the certificates have been prepared. don't have the opportunity to alter them. So, whoever comes in as a sub now will not get a certificate of participation. Is that agree? Okay. So, make a sub. Who is the line referee? Okay, so who is coming in? Let's appreciate her. All right, so I think we can go on, but one more information before we start. At the end of the whole quiz of the rounds, there is also a round that we have prepared. We call it special rounds. How is it special? In this special round, each MSA we have opportunity to pick 2 questions in rounds. And if you get the answer correctly, you stand a chance of getting a whooping 8 marks. I'm sure you know how 8 marks will boost your score, especially if you now get the 2 questions. It can make a lot of difference. But the catch is that if you miss it, you will get a negative mark, which is half of the 8. So, I'll stop here. When we finish the regular quiz, we will talk about it. Is it on the special rounds? Okay, so on special rounds, let's hold on with it. When we get to the bridge, we shall process. Okay. I believe at the end of the quiz, it's something some of you will actually request for. All right. Audience, are you ready? And like I promised yesterday, I have enough questions to go around everybody, even the audience. So, if you are interested in participating, we'll give you the opportunity, and it may come with a prize too. You can never say. All right. So, password. Okay, so let's allot for the pots. Let's allot for the pots. Okay, so who is going first for the blitz session? MSA. Okay, are you ready? Pot. What's the pot now? What? Okay. Technical man, are you set? Okay. So I want you to. We are starting with MSA. Scorer. Where is the scorer? You are set too. Timekeeper. You are set too. Right. Which port? 1. Okay. Thank you. So. Okay, timekeeper, when you are ready, tell me. Display. A patient with recurrent pyogenic infections has Cheddar-Gigashi syndrome. Skip. A patient with recurrent pyogenic infections. Next. Which country in the world has the largest exporter of natural gas?
Next, Iran.
Which cardiac nation is most strongly associated with its presence carotid system? What is the largest cave system in the world?
Dragon breath cave. Next.
Which hereditary syndrome is caused by which nerve is at greatest risk during the of which country consists the world's highest monetary a patient with refractory hypertension, hypokalemia, metabolic alkalosis, and suppressed which inherited deficiency causes unstable hemoglobin due to defective globin chain production. Which scientist introduced the concept of natural which has which person is most commonly injured in a posterior duodenal ulcer? Next, which protozoan which country has the world's largest production? Which inherited metabolic disorder is caused by deficiency? Which hormone is primarily responsible? Which state separates Asia from North America? Which congenital is most commonly associated with?
Economics.
Which Nobel Prize category? Which quantified
Vitamin deficiency.
Hey, a patient should stand up. Jam your hands together. It was very sensational. Okay, so here you are.
Are you good?
Somebody can snap it for you so that you have it. All right. Okay, take your seats. Next in line is BAMS. BAMS is going for port 2. Port 2. Timekeeper, are you set? A patient has recurrent infections with catalyst positive organism, partial albinism, peripheral neuropathy. Which country has the world's largest proven uranium reserve?
Wrong.
What is the largest moon on Saturn? Which congenital disease is naturally associated with? Which vitamin deficiency causes impaired gamma carbonylation of water? Which country has the highest GDP in the world? A patient with severe pancreatitis developed dyspnea bilateral pulmonary fluid despite normal cardiac function. What complication has occurred? Which renal tumor is commonly associated? Who developed the BCG vaccine? Which acid disorder is most commonly seen in diabetic acidosis? Injury to superior gluten nerve. Correct. Injury to superior gluten nerve. Which parasite is most common cause of inventory meningitis worldwide? Which country is the world's largest producer of palm oil? Which inherited disorder is caused by deficiency of? Which hormone is primarily responsible for increasing water permeability? Which sea is between Saudi Arabia and North Africa? A newborn has ambiguous genitalia short waist. Which metal is the best conductor of electricity? Which lung cancer is most commonly associated with ectopic Okay.
Correct.
Time up. Well done, that was sensational. Alright, can we have the answers for review by them? Alright, so we invite Funsa. Funsa is going for port 4. Alright, are you ready?
Yes, sir.
Are you ready?
Yes, sir.
Are you set? Display, please. A 24-year-old man has recorded episode.
Correct.
Which country in the world is largest producer of cocoa beans?
Correct.
Next, bacterium is the most common cause of epiglottitis among vaccinated children.
Correct.
Which is the largest anti-volcano on earth? Next, a child presents with eczema, Next, which muscle is responsible for initiating? Next, which country has the largest reserve of copper? Next, a patient with severe hypertension, renal failure, thrombocytopenia, and fragmented red blood cells. Next, vitamin is required for hydroxylation. Next, which proposed gene theory is of disease? Next, which acid-based disorder is typically seen in chronic obstructive pulmonary disease? Respiratory acidosis. Next, which nerve passes through the precandial space? Next, parasite is transmitted by the tsetse fly. Next, country has the world's largest reserve of cobalt. Next, the deficiency of which enzyme causes aortic aciduria with metaplastic anemia. Which hormone is secreted by the atrial myocardium to atrial stretch? Next, straight separates Europe from Africa. A patient develops recurrent bacterial infection with acid shadow on extreme. Which noble gas has the lowest boiling point? Next, cardiac is most commonly associated with Wolff-Parkinson-White syndrome. Long QT interval. Delta wave. Next. Mediterranean script. Next. Right, so show us the rest correct answers. Say again. Was it not said correctly? Please confirm if it's marked wrong, give them the score.
Which question?
We said million for this.
Hold on, please, sit down. Are you clear? Sorry, you are from which school? No, you are not permitted to speak now. Okay. All right, so we invite LAUMSA, and LAUMSA is going for port. Port 5.
Tell him to hold on so they can hear you.
Okay, timekeeper, are you set? LAUMSA, are you set? If any problem, I don't want you to face backwards.
It has been hardened. The attitude of your brother has been hardened for you.
No, you can't confirm now. Later on, just like you did yesterday, the scores will be displayed. You just keep your calm. Yeah? Keep your calm. Alright. On the Strait of Gibraltar, I had it. Okay? And I confirmed if it was marked for you. They said no, and I said you should mark it. So everything you said, I had it because I have the answer as well. Okay? LAUMSA, you said yes. Okay? Let's have 45 for LAUMSA. Timekeeper?
Yes, sir.
Go ahead. A newborn develops galactose 1 hospital
Which country is the
largest of rubber.
Which organism is the most common cause of
Osteomyelitis athletic shoes. Which is the largest island in the Caribbean? A patient has a chronic episode of fasting hypoglycemia, hyperglycemia, hypertension. Now this is the primary responsible for thigh adduction. Which country is the world's largest exporter of coffee? Brazil. Which developed a patient develops fever hypertension that kills the with drama. The vitamin B deficiency. Who discovered the electron? Which acid base disorder is associated in a patient with prolonged gastric infection? Which nerve is most commonly injured during parotid gland surgery? Metabolic patholysis. Next, which parasite causes which country has the world's largest reserve of rare earth elements? A deficiency of vitamins leads to accumulation of sphingomyelin. Which hormone stimulates testosterone production and ladies? Which sea is the world's largest saline disease? A patient develops sudden which metal has the highest electrical conductivity of all? Which inherited hereditary syndrome is characterized by? Next.
wrong.
I don't know. I don't know. Skip. Next. Okay. Green line.
Wrong.
Is this a wrong? Like this like We got a question type, measure from there, and at the end of the round, to measure the quiz story disease type 1. You said at the end of the round. Yes, before the round was before time we said the GS1. Yes, it should be marked for you already. So, take a seat. We invite Illusa. Illusa is going for port 7. Timekeeper, are you set? All right. Display port 7. Now time starts. Immediately develops abdominal distension. Which country has the largest reserve of phosphate rock? Which organism is the most common cause of
Pseudomonas typhoid. Skip.
Which is the largest up down in the world?
Skip.
A patient presents with hypermethyl skin lesion, diabetes mellitus cirrhosis.
Hemochromatosis.
Which muscle is the primary flexor of the distal interphalangeal joint?
Flexor LPS.
Which country has the world's largest proven reserve of potash?
Chile. Mexico. Skip.
A patient presents with the correct. Which vitamin deficiency?
Vitamin B2.
Who invented the World Wide Web?
Tim Berners-Lee.
Which acid-base disorder is seen in early phase?
Metabolic acidosis.
Which artery is perpetrated just anterior to the tragus of the head?
Posterior auricular. Anterior auricular. Swimmer's schistosomiasis.
Which Which country has the world's largest proven reserve?
Brazil.
A deficiency of which enzyme?
Tryptophan. Tryptophan. Skip.
Which hormone stimulates uterine contraction?
Cause oxytocin.
Which sea is the largest marginal sea in the Pacific Ocean?
Caspian Sea. Red Sea. Next.
A patient with recurrent respiratory infection, chronic sinusitis, and infertility. Which a young athlete collapsed during exercise. Person is doing asymmetric. Okay.
Pneumonia. FPP. Skip. Pneumonia and staph aureus, mycoplasma pneumonia.
Wow. Audience, please keep an eye on your neighbor, tapping their pulses intermittently, because this could cause urethria. All right, show them the correct answer. And with that, we come to the end of the beat round. And I believe it's been engaging. All right. All right. You can go and have your seat. Okay, so we effectively come to the end of this round, and I have the impression that Fumsa, yes, have something to say. Okay, Fumsa, go ahead.
Please can discuss the code so that we can know the scores. We want to know our scores. And it would be nice if we can always see the scores very well. And the question,
wait, the scores are displayed.
Yes, and to cross check because I don't think we were giving 28.
Wait. All the correct answers are recorded immediately you said them. Okay, the scorer is doing that. We are doing it here also, and if you notice, we are cross-checking. Okay, so now that it is not legible enough, honestly, it's because the way the table is arranged. Unless there is a way it can be zoomed, I don't know, but I can't say that. I can't. Say again.
Yes, the jam theory question that about coach, it was not given to us.
So what do you want to challenge? Is it that your answer was
the answer?
You said coach, you said Robert Koch. Yes, it's wrong.
Jam theory. Would I post confirm, sir?
I will confirm.
Thank you, sir.
So I'll take it.
Okay.
Bounce. Buy the mic today.
For the lead round, we believe that we got 12 correctly. I think we score 22. Instead of 22.
You believe so?
Yes, sir.
Is there one that you think they got correctly and was marked for you wrongly? Can you identify it?
Question 9.
Question 9.
Yes.
I think you've already said that and we clarified it with you. So believe is good, but we sort of work with evidence more than believe on this table. Okay? Now, you see, that's the shortcoming of having. No, he didn't say so. He didn't say so. No, we told you that we didn't have capillary. We can't mark it correctly. Okay, even if we said it was correct, and now it's wrong, then it's wrong. Okay? We are all clear now. Ifumsa.
Our ports also.
You want to
review our answers.
The answers. What do you mean review? Like to check. No, that's not allowed. That's not allowed. We already displayed it for you immediately after then. And hold on. Excuse me. The man from Musa. No, is it Musa? Yes. You were the one that first suggested that we review the pots. What was your reason for reviewing it originally when you suggested it? Give him the mic, please.
Personally, when we just get the scores after this round, we have to trust these masters, which we do. But the assurance is later on we get to review the questions and count for ourselves. So we are quite sure. So that's what it is.
Or maybe I didn't hear you very well. The purpose for which you suggested we review it, we show the answers so that you can learn. Did any other person have that? Okay, it was Fonsa that suggested it. Okay, sorry. Maybe I misunderstood your mind. Okay, so it seems that different reasons for the same request. Okay. Right, so personally, I wouldn't subscribe to doing it like this because you see, blitz session. Even sometimes you have the correct answer, far in your mind, but you pronounce something else. And we have been trained to hear what you said, not what you think. When you now see the correct answer, you're not like, I said it. Did I say it? You didn't say it. You thought of it. Okay? As we are listening, you know that the other MSAs too are also listening up. And then the audience. Okay? So, I don't believe showing the answer should be an avenue to start dragging this. No. It shouldn't be. But I think by and large, you are okay, right? And Bams, you agree with me that renal cell carcinoma is different from papillary renal cell carcinoma. Do you agree? All right. So, audience, a round of applause for them. All right. So, like we did yesterday, we still have some pots remaining, and I want somebody who is okay. Before I do that, okay. Okay, so I want one or two members of the audience who can attempt the bleed session to come up and try their luck. And I want to, and this is from me, if you are able to score 3/4 of the, you are able to get correctly 3/4 of the questions, the quiz master has a prize for you. Now don't ask me how much, because I won't use that to motivate you. I want you to motivate yourself.
Chadwick.
And you will not have the opportunity to pick the board. I will pick it for you.
Chadwick.
Anybody? 1, 2, going. Encourage him. Don't pass the mic to him. Okay, the young man is from UMSA it is. Okay, sorry. You need support. Oh my God. Oh, what is this? What is it? You came alone? If you like, you can be on guide. Okay, so that's cool. Is there another person that is interested? Is there another person that is interested? Okay, stand aside. Mohammed, right? The last guy. You are interested. Is there another person that is interested? Good. I'm going to divide you into two so that it will not be confusing. No problem. So, 1, 2, 3, 4, 5, 6. Separate. Okay. What's the matter? It doesn't work like that. Calculation Okay, I am in clinical. Raise up your hand. You'll be surprised that it's not by clinical. You guys are pre-clinicals, are they? Okay, clinicals. Capman. Which pre-clinical? Clinicals. Okay, so this is what we're going to do. The four of you. So the three of you stay back. Now I need 2 guys, or 3 guys from here to join them. And then, yes, so the rest of you man up with this junior. So which group is going first? You are going first. You don't have options. Come back. You came out first. You are going first. So let me open port 7 for, port 6 for them. Port 6 for them. Timekeeper, let's go. Are you set? Alright, let's have it. A child presents with the current incident. Correct. Which country has the largest population? The patient develops fever, a new heart murmur 2 weeks after extraction. What organism is the largest cause? Correct. Which is the world's largest area? A patient with episodic muscle weakness has persistent hypertension. Wrong. Skip. Which muscle is found responsible for forward supination whenever it is extended? Which country is the world's largest producer of uranium? A patient develops recurrent spontaneous hemoptysis, renal tumor, prostate, lymphoma. Which vitamin acts as a factor for inflammation? Who developed the first practical stem surgery? Which electrolyte abnormality? Which athlete passes through a doctor and to become the This is the party. Deficiency of which which of which race affects Savannah and mainland Australia? Great passage. The patient is required pandemic fever access pneumonia and later Iridium. Which element has the highest? Come on. Give those guys water. Let them cool down. They really felt it. They thought it was easy. But at the time, I wanted to stop to really check on them because I could have this asshole resignation. And all people are something like grade 5 moments. Okay, you have their scores? Okay, today, so open the pot for this. Right, gentlemen. So part 3 for them. Hello, are you ready? Let's have it. Timekeeper. Display. A newborn developed accessory that does not improve with 100% oxygen. Epidemiology confirmed. Which country is the world's largest user of vanilla? Correct. Which bacterium is the most common source of Which is the largest glacier outside Antarctica and Greenland?
Wrong.
A patient with chronic alcoholism develops confusion of pharmacopoeia.
Wrong.
Which enzyme is the deficiency?
Correct.
Which now, okay. Which country has the world's largest liquid reserve?
Wrong.
A patient with the current episode of severe abdominal pain, secondary symptom, and pot one urine, he has the deficiency of which enzyme?
Wrong.
What endocrine organ is derived from the transcendental pouch?
Correct.
What is the first human? Who is the first human to walk in space?
Correct.
Which acid-based disorder is most commonly seen in severe diarrhea?
Wrong. Wrong.
Which injury to non-thoracic causes paralysis of which muscle?
Correct.
What virus is the cause of bronchiolitis in infants?
Correct.
Which country has the world's largest research reserve? The deficiency of which enzyme causes galactosemia? Which hormone is secreted by the penis? Which is the world's largest sexual coverage by volume?
Wrong. Wrong.
A patient with recurrent epistaxis of mucocutaneous telangiectasia and living malformation as which chemical element has the highest atomic number that occurs naturally?
Wrong.
Which type of pharmaceutical reaction is responsible for contact with the crisis causing IV?
Correct. Wrong.
Time up. Wow, I'm impressed actually. I'm impressed. I'm impressed. So, help me collect their score. I'll get back to them. Alright, but by the way, is Brazil the answer for everything? I noticed that even when the participants were asking questions, almost every one of them got Brazil. So we quickly go ahead into the other aspects, and we are into the basic medical sciences without further delay. And so we'll start with UMSA. UMSA. Okay, you have questions 1 to 50 to make a choice. UMSA. Questions 1 to 50. Basic medical sciences. So questions 1 to 15. 32. 36. 2. Alright, display 32. What substance competitively inhibits LDH, preventing the oxidation of NADH?
First guess, aspartate.
Wrong.
Arsenic.
Wrong. So bonus is past the pounds. 5 seconds. Counting.
Oxaloacetate.
Wrong. Okay. Your question now.
Number 8.
Number 8 is available. Display 8. Block of descending cortical drive to which glycinergic spinal interneuron contributes to hyperdysplasia and clonus after spinal cord injury.
GABA.
Wrong.
Glutamate.
Wrong. Bonus. The FUMSA. Correct. Alright, so the FUMSA, your question now.
Question 2.
Question 2 it is. It's 2. Bradycardia, an apnea produced by sudden pressure and traction on the extraocular muscles, or the globe is called there's no
Time
hand
up.
saying it. Time up. Bonus to Laumsa.
Oculocardiac compensatory systems.
Correct. Ifumsa, confess to me, is that what you wanted to say? But why did you say it? I wish there is a way to penalize you for not saying what you were supposed to say. Okay? Even in your exams at school, say it. And it translates to practice. Alright? So, Lamsa, do you want to pick a question? 13. Question 13. Display 13. Activation of which channel protein in the principal piece of the sperm tail increases intracellular calcium and aids motility?
Axonine.
Wrong.
Spermine.
Time up.
Wrong. Bonus to Laumsa.
Camobulin.
Oh, wrong. That's channel. Let's go. Your question?
Question
11.
33.
33.
Yes.
Okay. Display 33. The phenomenon of the inhibition of glycolysis by oxygen is termed
Warburg effect.
wrong.
Boss effect.
Bonus. Your time is counting. Say it.
Time up.
I don't know it. That's all. Excuse me, I will be passing the mic. Please, physically fit to be running from this point to that point. No communication between participants. Okay, so who is running? Who is the runner? Somebody will be passing the microphone.
Someone from this club. From Laumsa this club.
So you ensure that you quickly pass the microphone between the two extremes. Your question, please.
28.
28. Open it. The artery of epistasis is the
Stenopalatine artery.
correct. Right. The question. Bounce. 35. The rate limiting enzyme for the Warburg-Pickens-Lippmann pathway is
Pyruvate. Pyruvate.
wrong.
Phosphosulfate
Wrong. Because
Time up.
so you see, we don't have enough mic to go round. But if you are asking a bonus, you already have the advantage that you have asked the question and have thought about it. Only waiting for the people in your front to miss it. So don't say you are waiting for mic before you answer. You have 5 seconds. Okay, I will take it as an excuse. Question. 20. 20 it is. Forceful traction by the peroneus brevis tendon on the fifth metatarsal stylo process.
Structure. No structure.
Wrong. I didn't hear that. Pseudo Jones, correct. Okay, display. The lower thickened part of tenons capsule is called wrong. Time out. Your bonus.
The Zuckercambus fashion.
Say it again.
Zuckercambus fashion.
No, wrong. So your question. Your question.
Question 34.
3, 4. Okay, display. The phenomenon whereby there is decreased respiration of the cellular system caused by high concentration of glucose is
Warburg effect.
wrong.
Anaerobic glycolysis.
Wrong. Casual. Use the mic.
Cancers.
Wrong. I thought I was hearing cracking, so I had to listen very well. Yeah, your question, the last question in this round. Let's have this your question. The encouraged.
37.
7.
37. 37.
37. I shall look for it. Alright, display 7. The anomalous lower edge of coracobrachialis forms a fibroid band known as
Band of Cantor.
Band of
Cantor.
Wrong.
Band of Cantor.
Wrong. Bonus to
Time up.
right, so bounce your question.
Number 16.
16. Okay, display 16. Audience, are you tired? Alright, 16. A small triangle within the submandibular triangle bounded by the posterior belly of digastric, the posterior border of epiglottis, and the greater horn of the hyoid bone, containing the lingual artery and the epiglossal nerve is called
Muscular triangle.
wrong.
Carotid triangle.
Wrong. Bonus to say again. Wrong. The class. The question is One. No, 7 is not available. 16 available? It's not. So, let me check. Alright, display 12. Activation of chemosensitive vagal C fibers in the cardiopulmonary region, causing bradycardia, hypertension, and apnea, followed by rapid shallow breathing, is called wrong. Hoffman? Wrong. Bonus. Bezos Jacket, correct. Question now. 15. 1 and 5. Display 15, please. A 45-year-old male develops dysphagia, nasal regurgitation after tonsillectomy. On examination, the gag reflex is absent on one side, but palatal elevation is normal. Which branch of cranial nerve 9 is most likely injured?
The branch to stylopharyngeus.
Correct. I can see the audience are back to like, no? They are not. We saw them. 2 and 4. Yes. Let's check if available. Okay, display 24. A pharyngeal diverticulum is commonly located in the posterior wall of the pharynx in an area called Killian's dentist. Correct. So we have come to the end of basic medical sciences, and believe me, we passed this somehow. Oh my God. Wow. Yes, that's why it is called the final round. The final round should be the final round, right? Okay, but don't forget, at the end of every round, I have my special rounds. See, holding it to my chest. Is there any emergency bags? Is there anything you need? Please, master. I have everything. Let's have it. Use the toilet, okay? But what do you think? Is it anterior or posterior emergency? We wait for him. So, participants, this is the opportunity to gather yourselves. Okay? Gather yourselves. Gather yourselves. You have come, you have come.
That was sex question. Come on, that was sex question.
Alright.
Ribbon. Odidi gbogbo àwọn obìnrin kan lè ṣe dákẹ́ lọ.
How was the exam yesterday? I have a quick exam on Wednesday. Okay. Was it pissed off? we used to talk to Ife. Ife taught us a lot of lessons that time. it was in effect, I first knew the full meaning of Boko Haram. He set it as a question. You know, in those days, Boko Haram was imagined, and it was popular all over the world, but nobody knew it really meant anything. The quizmaster just asked us that something good, otherwise called Boko Haram. What is the full name of the organization? I remember Ibrahim was sitting next to me. Surprisingly, the guy just collected the mic and said it. I think it took him almost 30 seconds to finish saying the name. Come and see how the hall became intense. And he got the answer. Something Jamaru, something, one long name like that. We never attempted in our practice. So how the guy knew that the question would be asked and memorized it up to today. I didn't know. So, all right. Oh, is it two people that went for toilet break? Where is this? Where is the other person? Okay. Anyone from MAIDEN here? Please go and check your guy. Don't rush him, just check his fine. Oh gosh. What do you think of your guy? Are you guys capable of continuing with former team? If you want to play music, make it very soft. That you want to settle stuff. How far with him? Did anybody go to check him? And that person is not back. Okay, hurry up. So we are going to another session that is basic clinical sciences. In basic clinical sciences, each participating MSc may answer 4 questions in rounds. Okay, and this time around we're going to start with the LAUMSA. And we go in reverse order. Okay, so we have questions 1 to 50. Questions 1, are you set, Sally? So we have questions 1 to 50. Make your choice. Number 14. So display 14. An HIV positive patient from Ohio presents with fever, weight loss, and hepatosplenomegaly. Serious stain of a bone marrow biopsy shows marrow-based bodies inside macrophages. What is the preferred initial treatment for this severe infection?
Fluconazole.
Wrong.
Amphotericin B.
Correct. Right, the question. LAUMSA. 2-2. Review 22. List 3 members of the Togaviridae.
Chikungunya virus. Syphilis virus.
3 members.
Young virus. Young virus, the chikungunya virus, and the rubella. Yes, rubella.
Okay, so you got chikungunya, you got rubella.
We mentioned young virus as a member of the Togaviridae.
No. Not my answer. Young virus, huh?
Yes, sir.
Okay. So you are challenging it, have you?
Yes, sir.
Alright, so we are able to confirm that it's part of it. So they have a So, pick a question in freestyle.
Question number 4.
And 4 it is. Flip 4. A 45-year-old woman presenting with progressive proximal muscle weakness, a heliotrope rash, and a Gottron purple. Her lab shows elevated creatine kinase and positive anti-Jo1 antibodies. What is your diagnosis and what is the next line investigation?
The diagnosis is dermatomyositis, and the next line of investigation will be to do a antibody panel for ANA.
Right. So, dermatomyositis is correct. The next line of action is wrong.
Respect.
The time is up. There wouldn't be bonus.
So, are we going to be giving any more?
Half mark, yes. Half mark. No bonus, please. All right, so pick your question. Down.
Number 20.
20. Display 20 is a bit long, so pay attention. Your time starts after I finish reading your question, and it's one answer. A 46-year-old woman presents with a rapidly enlarging painless leg mass causing progressive difficulty swallowing. On examination, the thyroid is symmetric, rock hard, and completely fixed to the surrounding neck structure. She is uterine, but serum IgG4 levels are markedly elevated. Which histopathologic finding and treatment strategy are most characteristic of this condition? Samoma bodies, dense fibrous tissue with Option what? Option B is correct. Right. Your question, please. Question 40. 20. Yeah. It's not available. Question 40. 20. 40. 40. Okay. Display 40. Which specific genes are mutated in sickle cell anemia and phenylketonuria respectively? No option of bonus.
In phenylketonuria, the gene mutated is PAHE. In sickle cell anemia, the gene mutated is HBP gene.
Correct. So in such a question that demands two answers, bonus will be available only if they miss the two answers. Right. Your question, 26. 6. Display 26. A farmer presents with fever and low white cell count. After a tick diet, a blood smear shows clusters of bacteria inside his monocyte. What is the diagnosis?
Ehrlichiosis.
Correct. A question.
Question 30.
Okay, display 20. 30. A full-time infant is born with severe microcephaly, a collapsed skull, and macular scarring. Brain imaging reveals thin cerebral cortices and subcortical calcification. The mother traveled to Brazil during her first trimester and What's the matter?
I give them another question.
Okay, sorry about that.
Another question.
32. Okay, it's play 32. A 45-year-old intravenous drug user presents with fever, a new hollow, cystic murmur, and painful nodule in his fingertips. Echocardiography reveals large fibrous vegetation on the tricuspid valve. Which microscopic changes will be observed in the microvasculature of the fingertips to explain the painful dermal nodule?
Osnani.
Correct. Your question.
Question 11.
Question 11. Display 11. A neonate presents with severe steatorrhea and failure to thrive. A lipid panel reveals completely absent plasma, VLDL and LDL. What specific genetic deficiency is responsible for this lipid disorder?
Apple C.
Wrong.
Apple E.
Wrong. Bonus. Wrong. Display the answer. Okay. Your question, please.
20.
Taking.
26.
Taking.
24.
Display 24. A 38-year-old woman presents with pelvic pain, a right trapezial mass, and severe symptoms of hyperthyroidism, including palpitations and tremor. Physical examination shows an unremarkable non-enlarged thyroid gland. Laboratory tests reveals a suppressed TSH. Pelvic ultrasound confirmed a complex multilocular ovarian tumor. What is the gold standard treatment for the benign presentation of this condition?
Excision.
Say again?
Excision.
Correct. Right, your question. Question 2. Display 2. A 24-year-old man presents with sustained fever, abdominal discomfort, relative bradycardia, and rose spots after returning from an endemic area. Blood culture grows gram-negative motile bacillus. Which virulence factor enables this organism to invade phagocytosis and cause systemic infection?
M protein.
Say again, please.
M protein.
Wrong.
Capsule.
Wrong. Wrong. Who knows? Factor HI. Wrong. Display the answers. Your question.
28.
28. Couple 28. A 45-year-old man presents with generalized edema, massive proteinuria, and hypoalbuminemia. Renal biopsy reveals a diffusely thickened glomerular basement membrane with subepithelial immune complex deposits, creating a classic spike and dome appearance of silver stain. Which autoantibody is most commonly responsible for this primary glomerular disease?
Anti-beta-1 glycoprotein.
Yeah.
Antiphospholipase A2 receptor.
Correct. Your question, please.
Question 7. Question 7.
Display 7. The 10-month-old infant presents with delayed developmental milestones and a history of seizures. Examination reveals an irritable child with fair skin, blonde hair, blue eyes, and eczema. The parents report that the child's diaper have a distinct musty odor. Without dietary intervention, this child is at severe risk of permanent intellectual disability. Now, what is the primary underlying enzyme defect in this patient?
Phenylalanine disease.
Correct. Your question is 44. It's not available, please.
What's line?
Okay. Pardon me. You have questions 1 to 43, please. Question 44 to 50 are not available now. So 34. 34. Display 34. List the triad of congenital toxoplasmosis.
Hydrocephalus, chorioretinitis, corneal calcification.
Correct. Question bounce. 13. 18, 1 and 8. Display 18. Two culture from a patient with fever and rose spot, rose a gram-negative, oxidase negative, motile, H2S producing, non-lactose fermenting bacillus. What is the primary chronic reservoir for these organisms? Audience, let there be silence. Man. Wrong. Peace. Wrong. Bonus. Man. Wrong. Display the answer. We didn't even say anything close to it. Because you said man, right?
The question. We are giving the last one. The last one to set up.
Thank you. Right, okay. So pick your choice now. 18. 18. Taken. It's just the immediately answered question. 12 is available. Reveal 12, please. A 38-year-old man presents with a first-time seizure and progressive headaches. An MRI reveals a calcified right frontal lobe mass. Biopsy shows uniform cells with round nuclei and clear perinuclear halos, the so-called fried egg appearance, in the chicken wire capillary network. What is the classic molecular marker hallmark required to definitely confirm this diagnosis?
First attempt, S100.
Wrong.
EGFR.
Wrong. Bonus. Wrong. Time is up. So we are in the last round. So last set of questions for this domain. Ilumsa. Your question, please. 33. Display 33. Which ultra-rapid acting monomeric insulin analog is formulated with niacinamide to accelerate subcutaneous absorption? One attempt, is it Fiat, is it Gel, is it Abizar or Novolog?
Novolog.
Wrong. Novolog. Perhaps. All right. Your question, Lausa. 2-2. 3. Question 3 is available. Display 3, please. A 12-year-old boy with a 3-week history of severe weight loss, polyuria, and excessive thirst is brought to the emergency department in a lethargic state. He is vomiting and exhibiting deep labored breathing. The physician notes a distinct fruity odor to his breath. Laboratory tests reveal a random blood glucose of 450 mg per dl and a notably low serum CO2 level. Which of the following best explains this patient's abnormal respiration pattern in one attempt? Compensatory hyperventilation driven by severe metabolic acidosis, primary respiratory alkalosis due to ammonia accumulation, acute hypoxemia secondary to pulmonary microthrombi. Option A. Option A, compensatory hyperventilation, correct. 25. Display 25. What is the drug of choice for the acute termination of paroxysmal supraventricular tachycardia? Adenosis. Correct. Number 1, please. A 45-year-old woman presents with episodic severe headaches, palpitations, and profuse sweating. Her blood pressure is 210/120 millimeter of mercury, and 24-hour urinary methamphetamines are markedly elevated, confirming a pheochromocytoma. What specific irreversible alpha-adrenergic antagonist must be administered first to control her blood pressure before surgical resection?
Phenoxybenzamine.
Phenoxybenzamine, correct. All right, last question for this domain. Question 10. Question 10 is available displayed. Coronary bodies. Correct. All right, with that, we effectively come to the end of basic clinical sciences. And we move on to clinical sciences A. In clinical sciences A, each MSA has an opportunity to answer 3 questions. And you can pick from questions 1 to 30. Now we start with ANSWER. Make a choice. Medical Sciences A. A. I'm not seeing it. That's it. All right, question 6. 6 it is. Question 6. Display 6. A Rubin test was historically used to assess cervical epithelial masses. Wrong. Ethnic pregnancies. Wrong. Bonus. Bounce.
Time up.
Time off. So display the answer. Let's see. Tubercular penises. Okay, pick your choice. Bounce.
Number 20.
Number 20. Okay. So 20, display 20. Spiramycin is primarily used during pregnancy to reduce vertical transmission of which infection?
Hepatitis B.
Wrong.
HIV.
Wrong. Bonus to influenza. Wrong. Okay? Display the answer. Make your choice. Influenza. Question 1. Question 1 it is. Display question 1. A child with recurrent nephrolithiasis, hypercalciuria, nephrocalcinosis, and ocular abnormalities most likely has which syndrome? Wrong.
Crohn's disease.
Wrong. Which school? Wrong. Williams. Wrong. Display the answer. No, your choice, please.
Question 7.
Question 7. Display 7. Child has angiokeratomas, acroparesthesias, and progressive renal impairment. Which lysosomal enzyme is deficient? Alpha galactosis. Is it correct? Yes, correct. Your choice, please. 25. 25. All right, display 25. A child with Noonan syndrome most commonly develops which cardiac tumor?
And coagulation of the aorta.
Wrong.
Transposition of the great artery.
Wrong. Who's taking it? Say it. Say it.
Ventricular septal defect.
No, wrong. Display the answer. So make your choice.
Question 24.
Question 24. Okay, display 24. A banana sign on fetal ultrasound is classically affected with which condition?
Neural tube defect.
Wrong.
Spinal bifida.
Wrong. Bonus.
Simon.
Wrong. Display the answer. I know they will challenge it. They have shown themselves. Say it. You want to contest it?
Thank you very much, sir. The question was banana sign and fetal ultrasound. We think we're confident fetal is correct.
You think?
We're confident fetal is correct.
Fire bifida is correct.
Yes, sir.
Okay? Good enough. So let's
Verify for them.
And I want this guy to jump off from there, sit somewhere else.
Yes.
You are distracting them. Please. Yes, I will relocate. So, we've been able to verify that it is associated classically with anode carrying malformation. Contest closed.
That's we get in 5 minutes.
Say again.
We get in 5 minutes. 2 minutes.
And let's finish the round. Let's finish the round. Sit down. If it's very urgent, the person that wants to pee should go, but we'll continue. All right. So, which school is it? So we'll be fast about it so that you can go and pee. Okay? All right. Pick your choice. Question 2. Display 2. The quintero classification is used to state which condition? Wrong.
Simon.
Wrong. Correct. Your question, please.
This question 3.
Question 3. Display 3. Blank white Gallant syndrome is anomalous origin of which artery? Say it. Wrong. Time up. Bonus. Wrong. Display the answer. Before you say the said Bulgaria, you check the answer very well. And the other guy said right, not left. Okay? So, please, audience, do you know that they are transmitting this competition live?
Okay.
Okay. So, let's go. LAUMSA. Question 15. 15. Display 15. Hemoglobin bags consists of which globin chains? Gamma 4. Gamma 4, correct. What question? The books are right. 26. 26. Display 26. The Youssef syndrome is characterized by the triad of cyclic hematuria, amenorrhea, and absence of what symptom?
Abdominal pain.
Wrong.
Hemoptysis.
Wrong. Which particular bonus? Say it if you know it. 5 seconds is counting.
Time up.
Alright, so display the answer. So let's quickly go to the last questions in this round so that we can have them go P.
Question 17.
17. Yes, open 17. Display 17. Neonatal severe hyperammonemia with respiratory alkalosis most strongly suggests deficiency of
Carbomoil phosphate synthase 1.
Wrong.
UFP synthase.
Wrong. Bonus. Ornithine transcarbamylase. Yeah, even me, I read it in your mind. Or you hesitated. Alright, your question please.
Number 8.
Number 8. Okay, display A. Which ovarian sex called stomach tumor produces calexnar bodies? Correct. Alright, your question, Kimsa. 22, display 22. Iridigen maneuver is indicated in obstructive label. Wrong. Shoulder is posted. Wrong. Say it. Wrong. Display the answer. If only you could. Your question, answer.
Question 21.
Question 21. Display 21. A phenotypic female with hypertension, hypokalemia, absent secondary sexual characteristics, and 46XY karyotype most likely has deficiency of which enzyme?
Level hydroxylase deficiency.
Wrong.
21 hydroxylase deficiency.
Wrong.
Is that so high?
Bonus.
17 hydroxylase deficiency.
Correct. Your question, and the last question for this domain. Make a choice.
25.
25. Taken.
18.
Yes, 18 for you. Display 18. The bulge look diameter refers to which diameter of the pelvis?
The transverse diameter.
Wrong.
Anterior posterior diameter.
Wrong. Say it.
Timer.
Hospital transverse diameter.
Wrong. Say the answer. Alright, so we got to the end of clinical sciences A. You see our clinical sciences B, case, right? Hold on please. How many of you are going on the wee blade? What's happening? Is it that the weather is cold? Okay, so since we have multiple people going, we will take 5 minutes break starting from now and we will converge. The quiz will start again at 2:55. 2:55. We will not wait for anybody. Okay?
Are we the only one watching? You can't be when I they are reading it out loud. Anybody watching it?
More music on trendybeats.com.
I can only see Lausa that is seated and Ilumsa. Bams, where are you? Umsa, where are you? Umsa, where are you? Please, participants. participants, be seated. Participants, we are starting the next round now. Please be seated. Audience, please come inside. We are starting now. Please come inside. I can only see LAUMSA seated. Okay, Banks, IPUMSA, ILUMSA, and UMSA, where are you? Okay. UMSA. Okay, we are starting now. Thank you. Audience, please find your way back to the hall.
Your bankers.
All right, so we move on after the short break, and we quickly go into the other aspect of clinical sciences, that science D, bordering on internal medicine, surgery, special postings, and the likes. All right? Okay.
Thank you very much, sir. We very much have a chance to review questions from the last round. Another side, we find a little source that says we're correct.
We already closed the challenge, but since we open it, we defy it to the end of the competition. So, thank you very much. All right, so this time around, we are going to start with ILUMSA. Medical Sciences B. Have you seen it?
Use the mic. Use the mic. Give it to him. Let him talk. Let him talk. No, there's no light. Set power is down. Apple B was wrong. The answer is the Apple B was wrong. Secondly, was the bonus question. All right. Can you hear me? The question on the banana sign. The question read that banana sign on all ultrasound is specific for which disease? Okay? And the correct answer was amebiarin malformation B2 rather. So there is really nothing to protect about. Yeah. Is there on another thing? On another matter? Let's see how you do. Say it. No problem, we are being helped by answer. It was question 24. And it reads again. The banana sign is classically associated with this condition. Okay? Now, in neurative defects, including MAIDEN, MedIQ, spinal bifida, MedIQ, what have you, they usually occur in situation. So if you check the textbook, okay, that will say that this particular type is present in spinal bifida. But if the spinal bifida is not in association with the upper tube defect, like MedIQ, okay, classically means that if you check it in this condition, you find it, regardless of whether it is present in association with other. Okay. how can they the decision? That's what I'm saying. We unify that like that. Also, part of the law. So if it is not, then your letter might be wrong. It's also I'm certain about it. I have all the games. Well, it's okay. Your point is all right. For the answer now, and one of the reasons, one of the things, here you probably go back and making something. Or start. Now, the organizers of the competition are not the funders. You've seen places where said that after already and they should not check I still have this competition. It has happened. Alright? And I've seen cases whereby the answer is the computer. Even me, I didn't know. Okay. And I contested it for
the answer on red is upper galacticity. I said it's wrong because it's the upper galacticity. You might do that for
Bidwan, o superior, mi